Once I rose above the noise and confusion, just to get a glimpse beyond this illusion. I was soaring ever higher, but I flew too high.
Hi, everybody, and welcome to another episode of Did You Know? Today we're going to be talking with Adam Burch. Adam is a chiropractor and the owner of Derry Joint and Spine Center in Derry, New Hampshire, where he specializes in non-surgical, non-pharmacological, is that how I say it, Adam? Non-pharmacological pain management and rehabilitation. Adam can correct me.
It's real close.
It's really close? Okay,
Yep.
That's good. How do you pronounce it?
Pharmacological.
Pharmacological.
It's just the right emphasis on the right syllable, that's all.
All right, excellent. Thank you. You have also been involved with the National Ataxia Foundation on and off for the past 4 years, and you bring a new approach to solving the everyday challenges that come with ataxia. John and I personally have a relationship with Adam. John was probably one of the first patients Adam saw with ataxia, and what stood out to me was his curiosity in wanting to help John and wanting to learn as much as he could about ataxia. And he has been a great partner with us in our walks that we hold annually. And in fact, this October, he's going to be attending our walk and roll in New Hampshire, and he's actually going to speak at that walk. So, Adam, I'd like to welcome you.
Thank you very much. I'm glad to be here.
Thank you. Thank you for joining. I think it's probably important to touch on a couple of points, especially for those people that might be new to this whole diagnosis and very frustrated that they can't do things the same way that they did it, that they once have done them. And they feel like they're very limited in their ability to do certain things. So I'm wondering, from your perspective, when you first see someone that has a physical limitation, what are some of the things that you look for, and what are some of the questions that you might ask that person?
Well, for starters, especially if this is an adult who's just had the symptoms onset later in life, it's important to approach it very much like you would with somebody who just had a stroke out of nowhere. Last year, they were going about their normal life, doing hobbies, going to work, carrying on as though, it was going to continue being like that forever. And to have a life-changing event, you have to be ready for a little bit of frustration, anger, sometimes even depression, and that's a very normal thing. So the key point really is to start off by finding out what's different from the way it used to be, how much different it is, and whether or not there's an alternative way to achieve the same result. Something as simple as putting on your jacket and going out and walking your dog. That may not be the easiest thing when somebody has ataxia compared to, everyday person walking down the street, but it doesn't mean that you can't do it. It might mean that you just need to do it a little differently.
Yeah, and I think in my experience with you and with John, I do remember you, constantly reminding us about that, right? It's not that you can't do it, but the way that you have done it has to be, you can't do it that way, but you need to find an alternative way to do it. And just being able to explore it. Yeah. So I know that, for John, when he was first diagnosed, I think we went to a number of people before we settled on you. And I think that it sometimes is frustrating from that perspective, and something that somebody needs to understand, that you might not make a connection right at first. You may need to try a variety of providers or even a variety of different things that might work for you. I was wondering if you could say a little bit about that.
Certainly. So especially with something like ataxia, Not every doctor is going to learn about it while they're in school, and even if they do learn about it, they might only learn just a very surface level amount in passing.
Like a textbook definition or something.
Yeah, they might have about a paragraph worth of information on it when you first show up at their door. And for the providers, for the physicians, the nurses, that can be a little intimidating because normally when the patient walks in, they expect you to know what's going on, know how to treat it, know what their options are. And if you're caught off guard, you don't have that information at hand. A confident provider will just tell you. And then they'll do a little bit of looking up, a little bit of digging, a little bit of reading on their own, and tell you whether or not they think they're the right provider to work with you. Those who are a little less sure of themselves may just kind of brush it off and attempt to sort of act like they know what they're going to do next, and then wait until you leave the room, and that's when they dig out their phone or get online on their computer and start looking through, WebMD or a textbook that they have on a shelf or something else. And what I would say is, if you're approaching a new physician, a new specialist, a new physical therapist, a new chiropractor, what have you, what you want is somebody who's most interested in developing a good doctor-patient relationship with you, somebody who has good bedside manner, somebody who's willing to sit and listen first before going into telling you what to do next.
Yeah, I would agree with you, and I think that's important regardless, whether you have ataxia or not. I think you should always be in search of that provider who you trust and who you feel is really listening to you and making recommendations that are going to work for you and maybe even your particular lifestyle. I mean, we started out by saying, if you have a dog to walk, maybe sharing those things with the provider to say, on a daily basis, these are things I need to accomplish, and how is it best that I can do some of these things because I'm having trouble doing these things right now.
Yeah, it's helpful in any conversation with healthcare providers, regardless of specialty, to be focused whenever possible on solutions. Looking for a solution to the problem rather than reasons. Why you as an individual may have gotten a diagnosis of ataxia or any other condition out there isn't quite as important as what needs to be done next to work through it or work with it. So having a problem-solving mindset helps a lot.
And curiosity, would you say? I mean, just being curious and wanting to know about how this is affecting the person, or, what you can do, as you say, to help them.
Yeah. If you have an interaction with a provider and they don't ask you very many questions, I would be concerned. And really, when you're first getting to meet somebody new, it's important for both of you to ask questions, as many as you can, until you're sure that you're on the same page. They should want to know as much as they can about you, about the disease process in and of itself and how it's affected you specifically versus what they were taught to expect in a textbook, if anything at all. And at the same time, as a patient, you should ask as many questions as you can while you're there, and try to take notes. Go back over your notes when you get home, and that can be a good jumping off point to find more information from support groups or places like the Ataxia Foundation website, where maybe some key things that the doctor told you in the room can then come home with you and lead you down a little bit of research of your own.
Yeah, I think education is key, just educating yourself as much as possible. And also, I know with John, one of the things we found that was very helpful is if he documented different things. So like he was maybe having difficulty going upstairs, and then he tried a new way to go upstairs, and that worked really well for him, so he made a note. or he tried that new way and it didn't really work very well for him, and he made a note. And so the next time he came in to see you, he could kind of review that with you and say, this really didn't work for me. Do you have other suggestions?
Keeping an accurate record, especially in the beginning, of what works for you and what doesn't work for you is very helpful, at least to me, right? So if somebody like John were to come into my office tomorrow and they had a list of the things that they struggled with, what they had tried to work around it, and what how each of those things had worked, that makes my job easier in figuring out, is there any type of rhyme or reason pattern to it. Maybe they didn't all work because of the same basic underlying problem, or maybe I can come up with some things that they haven't tried yet.
Yeah, exactly. And, I think, too, it just gives you a line of sight as to, what they have been trying and, how successful. So if you were thinking about recommending something and they've tried something similar, that that's probably not the recommendation to make, that you should be thinking or about other ways to accomplish it, as you say.
The worst thing that I can think of as a patient myself, if I were to go into, say, a primary care office or a physical therapy office or a neurologist, is to be told the exact same recommendation that I had just had at the last person that I met, and to have already tried it and know it's not going to work.
Right.
That
Yeah.
that to me as a patient would be extremely frustrating. And so I make the assumption that it would be for everyone else.
Yeah, no, I agree with you. Let's talk a little bit about movement in general. So, a lot of people who get diagnosed with ataxia have really pretty marked issues with movement, and a lot of them are wheelchair bound. And sometimes the thought is, well, I'm in a chair and I can't do anything. And that's really not your belief, right?
Not at all. There's two ways to approach any chronic disease, and this works whether we're talking about ataxia, multiple sclerosis, cerebral palsy, Parkinson's. You can either do nothing, in which case you're guaranteed to get worse, or you can do something, anything. You do as much as you can, you move around as much as you can in a safe manner, because every bit that you preserve for tomorrow is going to be available to you when you want it. And that was consistent when I was working with John. That is consistent with every other type of movement disorder I've seen, is that it's important to keep as much of your capacity, whether it's strength, endurance, balance, coordination, as you possibly can for as long as you possibly can by any means safely available to you.
No, I would absolutely agree with you. And sometimes I think, even in my own personal experience, if I've had an injury, you want to baby it, and you think that if you can't do the full range of motion, that it's not helpful to even just do a little bit. And it's really not true.
Oh, no, it's not true. And there's also a very big difference between, a chronic condition like ataxia and an acute condition like a sprained ankle, right? So if you roll your ankle walking off the sidewalk, it's not unusual to put a splint on it for a day or two, if it's bad enough. It's not unusual to wrap it with an ACE bandage. And to baby it for a couple of days helps jumpstart the repair process. When you're talking about something like ataxia, this can, if left unchecked, be a progressive disease, so doing nothing about it just makes it easier for it to progress and get worse.
Yeah, I would agree. And I think part of the education that has to happen is around what constitutes a movement, for lack of a better way to describe this. But, it's like we have certain mental images in our mind of, exercise and movement, and they all seem to be pretty, require some effort. Like, I want to lift my arm all the way up to the ceiling. But if I can't do that, it's beneficial to just lift it a few inches and just continue to practice doing that until I can do a little bit more, and then keep up with that little bit more until I can do a little bit more. So I think that it's important for people to realize that any movement, like you say, is really critical in keep going with this stuff.
Yeah, really, you want to press your boundaries every day. Um, inside of your comfort zone, you're not going to make any progress. You don't want to take unnecessary risks, but you want to be mildly uncomfortable because of exercise as often as you can be. For instance, the reaching up overhead. Reaching up overhead, maybe you don't need to do it all day long every day, but if you try to do it at least a few times each day, you'll find that over the course of weeks or months, you'll slowly be able to reach a little higher. With ataxia, there's not a physical block on the joints themselves or the muscles. They're all capable. They're just getting mixed signals from the brain down through the spinal cord. And the more you use them, the more clear signals might get through. It's not guaranteed, and you certainly can't overwrite the problem and reverse it. But even if you got 50% improvement, that's better than none.
No, I would agree. I know that one of the things that's always amazed me about John is, he gets fatigued and he needs to sit in a wheelchair and take a rest. His walk is not as good as it was. However, the strength that he has never changed. Like, he still has the strength. It's just that they don't move his legs don't move in the same way that they used to. So I think it's important to know that.
Yep. It's you want to take calculated risks. I mean, when John and I were talking recently, he was saying how whenever possible he tries to walk out in the lawn without canes or a walker until he starts to feel fatigued, because that helps him keep the ability to do it. But that right this moment there was a lot of acorns around the yard, and that it probably wasn't in his best interest to do it until they got cleaned up. That's a calculated risk. On a clear day when it's nice and sunny out, the grass is nice and soft, and there's not a lot of tripping hazards, go for it. In the event that that you get tired, sit down. And I know I've seen John do this, where he gets fatigued out enough where he needs to lay down for a little while. But once that initial part passes, then you see how much you can do next. Can you get up on your own, or do you need a little bit of help? And as long as you plan those types of activities for when it's safe to do it, then there's no reason not to.
Yeah, no, I agree with you. Well, in summary, I think that I'd like to hear your perspective. If you were talking to somebody that had ataxia, what would be 2 or 3 main points that you would want to get across to them?
If it was somebody who just got the diagnosis, my first thing would be, don't take the first provider who comes your way. Find somebody who will work really well with you. Learn as much as you can about how ataxia works, how different types of ataxia behave, what type of home strategies you can use. Go meet with the support groups. And then the last part really is, don't ever give in or give up. Push back against it as hard as you can every day, because that's the only way you'll keep having a quality life.
Yeah, really great advice, Adam. Thank you so much for joining us today. And as always, I hope that you take something valuable away from the podcast and that you learned something. I hope that you are ready to go and ask a lot of questions of whatever provider it is that you're seeing. And until next time, enjoy the rest of your day, and thanks so much for listening.
Once I rose above the noise and confusion. just to get a glimpse beyond this illusion. I was soaring ever higher.